Hello, and welcome to this edition of Medicare Scholar, brought to you by David A. Krotz & Associates Insurance. I'll be your host, Chris Johnson, and in today's program, I'm going to discuss Original Medicare versus a Medicare Advantage plan. So whether you're already on Medicare, or maybe you're turning 65 and exploring your options, please stay tuned to our video. Welcome back, ladies and gentlemen. Thanks again for taking the time to join us. As I mentioned, my name is Chris Johnson, and in today's program, I'm going to go over Original Medicare versus a Medicare Advantage plan. Now, I have a lot of information I'm going to share with you today, so let's jump right in. Now, the first topic I'm going to cover is your choice. Did you know that beneficiaries have a choice when it comes to their coverage? You can choose to enroll into an Original Medicare, which includes Part A, which is your inpatient hospitalization, Part B, which covers your outpatient or doctor's office visits, and you can purchase a Part D plan, which covers your prescription drug coverage. Or you can choose to enroll into a Medicare Advantage plan. This combines Part A, B, and D all into one package. Now, there are numerous differences between these two options, including enrollment periods, the coverage offered, the network, how it's billed, your prescription drug coverage, as well as extra benefits that may or may not be included in each program. Alright, ladies and gentlemen, let's jump into the next topic. Let's cover enrollment. Now, enrolling into Original Medicare happens during 3 distinct time periods, with the first being your initial enrollment period, also known as your IEP. The second is the General Enrollment Period, known as the GEP, and a Special Election Period. Now, the IEP is centered around the beneficiary's 65th birthday month and begins 3 months prior and ends 3 months after. If the beneficiary chooses not to enroll during the IEP, they have the opportunity to enroll during the GEP. This starts each January the 1st and runs through March 31st, with the benefits beginning on July 1st of that year. These days, many individuals, maybe even yourself, are choosing to work beyond the age of 65 and may delay enrolling into Medicare if they are covered by group insurance based on maybe their or their spouse's current employment. Now, they have the ability to enroll anytime they are covered by the group plan and up to 8 months after they lose employment or their group coverage, whichever happens first. Now, like Original Medicare, enrolling into a Medicare Advantage plan can happen during specific time frames, including the initial enrollment period, your IEP, an annual enrollment period, which is known as your AEP, open enrollment period, known as the OEP, and there are numerous special election periods. Now, the IEP for Medicare Advantage is based on the month the client receives both A and B entitlement, and generally their 65th birthday month. And it begins 3 months prior and ends 3 months after. Each year, all beneficiaries have the ability to enroll into, change, or cancel their Medicare Advantage coverage during what's known as the AEP, which starts on October the 15th and runs through December the 7th, with the change going into effect January 1st of the following year. Now, individuals already on a Medicare Advantage plan can utilize the OEP to make a one-time change to their coverage. From January the 1st through March 31st, they can change their MA coverage, disenroll and go back to Original Medicare, and enroll into a standalone drug plan if they choose. Now, let's say you're outside of the IEP, AEP, and OEP. Beneficiaries have the ability to enroll into, change, or cancel their Medicare Advantage coverage using an SEP. The most common SEP are loss of group coverage, qualifying for Medicaid, or maybe extra help, and a change in residency. Now, I have on our website where you can refer to United Healthcare's election period grid for full details. Alright, so our next topic is going to be the coverage. Medicare Part A covers a beneficiary if they are to receive Medicare-approved care at a facility, including inpatient hospitalization, skilled nursing facilities, and home health care. For inpatient hospitalization, the client must satisfy the Part A deductible before Medicare will cover the rest of their care for the first 60 days. If they are in a hospital beyond 60 days, they will pay a per-day copayment up to 90 days. Now, beyond 90 days, the client is utilizing their lifetime reserve days, or which of only 60 are available while the client is enrolled in Part A. All charges beyond that lifetime reserve days are the responsibility of you, the beneficiary. Now, let's talk about your Part B. So Part B covers a beneficiary's outpatient Medicare approved charges, including physician's visits, outpatient tests, and imaging, outpatient rehabilitation, durable medical equipment, and some medications if they are administered at a doctor's office or an outpatient facility, like chemotherapy and infusions. Each year, beneficiaries satisfy a Part B deductible, then they receive 80% coverage for the services, leaving them responsible for 20%. Now, there is no maximum amount that 20% a beneficiary may pay in any given year. However, Medicare Advantage plans work very differently and utilize a series of co-payments, which are set dollar amounts for specified services, and co-insurances, which is a percentage they pay for a specified service, which can be found in each plan's summary of benefits. Each Medicare Advantage plan has their own list of co-payments and co-insurances, so understand that benefits can vary widely between available plans. Medicare Advantage plans have a maximum out of pocket, which make them unique compared to all other parts of Medicare. All of the plan's co-payments and co-insurances apply towards this maximum out of pocket, also known as a MOOT, giving the beneficiary an absolute limit on their annual spending for all covered services. Prescription drug costs and non-covered benefits do not apply towards this maximum out of pocket, however. Moving right along, let's talk a little bit about the network. Now, beneficiaries with original Medicare can see only a doctor or a facility that participates with Medicare, which in 2020 is currently about 93% of all doctors in over 5,300 hospitals in the country. Medicare Advantage beneficiaries must utilize a network of providers for the coverage based on the type of plan they are enrolled in. There are many different types of plans, so let's talk about those. First one is the Health Maintenance Organization, also known as an HMO. Beneficiaries must choose in-network providers situations or utilize urgent care situations. The second one is your Preferred Provider Organization, also known as your PPO. Beneficiaries can utilize the plan's network for providers and facilities to pay lowest co-payments, co-insurances for covered services. Now, they're able to go outside of the network, but will pay a higher out-of-pocket cost, and they must still see the provider and facility that participates within the Medicare program. Okay, ladies and gentlemen, let's talk about a very important category for everybody, the billing. Physicians that accept Medicare are broken into two categories, either participating or non-participating. So let's discuss what participating provider means. A participating provider accepts Medicare assignment, which means they agree that Medicare's limit for each service is payment in full. These are providers bill Medicare directly for the services, and they are paid directly by Medicare. Okay, so let's talk about non-participating providers. A non-participating provider accepts Medicare clients, but they do not agree to accept Medicare's limits for the services. They are allowed to bill up to 15% higher than Medicare approved amounts. These providers will bill Medicare directly, but Medicare will pay the beneficiary, and it is the beneficiary's responsibility to pay the provider. So let's also talk about other providers, which are the excluded providers, because there are also excluded providers that do not participate and are unable to bill Medicare for any services. It is the beneficiary's responsibility to cover the cost of the services received from an excluded provider, as Medicare will not reimburse for any of these expenses. Now, Medicare Advantage plans take the place of original Medicare when it comes to billing. Providers bill the plan directly for services, and the plan will pay them back directly, leaving the client to pay any applicable co-pays or co-insurances for that covered service. If there are any issues with the billing, both the provider and the client can reach out to the plan for assistance. So it gives you a little bit of extra help. So when referring to extras, let's talk about that a little bit more. Original Medicare provides few extras, in fact, but those that are provided are essential to help the beneficiary stay healthy and active. As a matter of fact, upon enrolling into Part B of Medicare, each beneficiary qualifies to receive a full physical within the first 12 months of joining, and it'll be paid at 100%. Afterwards, Medicare will pay for an annual wellness visit, which is a list of questions that are reviewed with the beneficiary and covers a wide range of topics, including your physical, emotional, and mental health, your medication adherence, concerns, and so on. With Original Medicare, understand that it also covers a wide range of preventative services to help you, the beneficiary, detect any illness or disease at an early stage, including your bone mass measurements, cardiovascular disease screenings, cancer screenings, colonoscopies, diabetes screenings, mammograms, and many more. Now you can visit medicare.gov/coverage/preventive screening services for more information. Okay, so let's talk a little bit about the Medicare Advantage extras. Medicare Advantage plans include all the extras of Original Medicare, plus other benefits which make the plan very attractive to some beneficiaries. These extra benefits may include benefits by plan such as dental, vision, hearing, fitness, transportation, chiropractic, acupuncture, annual physicals, post-discharge meals, telemedicine, and some even offer over-the-counter supplies. And there's much more. Beneficiaries can refer to the plan summary of benefits for a full list of these that may be included. Now, the other topic that I want to touch on today is very important to a lot of us, is prescription drug coverage. Beginning January 1st of 2006, Medicare beneficiaries could enroll into a Part D of Medicare to help cover the cost of outpatient prescription drugs. Those on Original Medicare would sign up for a standalone drug plan, also known as a Part D plan, where provided by private insurance companies. Whereas many Medicare Advantage plans include Part D coverage built right in as a part of that plan. So the client receives their health and their RX benefits from one company. These Medicare Advantage prescription drug plans are also referred to as MAPDs. Clients with a PFFS Medicare Advantage plan have to enroll and have the option to enroll into a standalone Part D drug plan. Well, ladies and gentlemen, that's all I have for you today. I hope you found our program to be very informative. Please know that we have professionals that do specifically Medicare plans and have a real deep understanding. So if we can help you do that, don't hesitate to contact us. Shoot us a message on Facebook or drop us a comment or shoot us an email. Thanks again for tuning in, and we'll see you next time.